Okay. Hello, and welcome to today's episode of Health University, where I have the pleasure of speaking with Cassandra Pratt, and she goes by Cass, correct, Cass?
Correct.
Yes,
Yes.
and Cass is the Chief Human Resources Officer at Progyny. Progyny is a leading fertility, family planning, and women's health business and benefits company. And Cass brings her experience leading human resources, talent acquisition, learning and development, and employee experience at the growth stage of companies to Progyny. Prior to joining Progyny, she was director of talent at Signpost and TravelClick, a global provider of innovation and cloud-based and data-driven solutions for hotels. Progyny is, of course, a huge asset in the fertility world. And so I'm really grateful to have you here today, Cass. Did I miss anything in the intro that you'd like to add?
You did not. No, I think
Okay.
that's a great summary. It's very nice to
Okay.
be with you and talk to you today too.
Thank you. Thank you. So tell us, how did you come to Progyny, and what does it mean to you to be working in Progyny especially at this time in our lives and worlds?
Well, I came to Progyny about a little over 8 years ago,
Mhm,
and I was coming out of the tech world, as you just mentioned, and I
mhm.
was really looking for a mission-driven company. And I found this small little startup called Progyny at the
Mhm.
time, back in 2016. And I just thought it was such an interesting mission. The people were very passionate about what they were doing, and I decided to join. And we started scaling, we started, changing our focus and growing our products. And then about 2 years after joining, I realized I was actually going to have to go through an IVF journey myself,
Oh, isn't that
uh,
interesting?
and several rounds of IVF. And
Mhm.
4 years later, I ended up with two boys. So I have a 4.5-year-old and an almost 3-year-old going
Oh,
on.
congratulations. So
Thank
you
you.
know firsthand personally just how important it is to have this medical support accessible, and to have it accessible through the corporate wellness field. It can be just unbelievably expensive. And when I started 23 years ago, people were taking out second and third mortgages, and I could actually get a little teary just thinking about it, because they were really throwing everything they had into this existential desire to grow a family, and it was all on their shoulders. So I'm, for one, probably the biggest cheerleader for the corporate wellness field, for Progyny, in bringing not only claims reimbursement, right, because it's much more than that, but also, the services that you offer to the corporations and the individuals going through this endeavor.
Well, and I think it's interesting to talk about what has evolved to, not just the coverage, because even when I started 8 years ago at Progyny, I'd only talked to one or two friends about their fertility journey, and they were later on in their fertility journey. It was impacting all different elements of their lives.
Mhm.
And then I came to Progyny, and it was probably 8 months before one of our employees started talking about their own journey.
Mhm.
And then it just seemed to snowball, and people became more and more comfortable talking about it. Having been in other areas of HR at much different companies, no one ever discussed things like this as
Right.
openly as they do at Progyny. And we started to see that also show in other workplaces where people were starting to offer this benefit. So some of our early clients started facilitating conversations. And now to see where we are 8 years later, I just think is truly incredible.
Absolutely, absolutely. I know, from having worked in private practice with these individuals, that their experience internally was one of isolation and shame or embarrassment, and they felt that they couldn't speak with anyone. And ironically, right now we know it's 1 in 5. I mean, tragically, this has become more and more of an issue, but thankfully, it's also become more and more of an issue that can be resolved with medical support and with the support of a company like Progyny. I'm very curious, because when patients come into me and they have, claims reimbursement, they seem to have a little filter around that's all they're supposed to seek. And I know that there's a lot more accessible to them. So could you speak to that a bit?
You mean from terms of how a company can support their employees?
Exactly, exactly.
So there are lots of different elements to the support. So we can talk about it both from a family building, but that even starts earlier, preconception. And then if you are lucky enough to conceive and have a live birth, then there's the pregnancy and the postpartum. And then, as we all know, midlife and menopause happens to every single one of us.
If we're
uh,
lucky.
yeah, early stages of that. But I think, we're facilitating conversations with employees. We talk at Progyny, we talk to our employees about the benefits really frequently. We know different people learn differently and hear things differently. So we try to use multi-channel approach when we're talking to them. So whether that is a town hall, employee communication plan, some other type of sort of in-person communication, or we just launched our Progyny internal employee podcast where we talk about our benefits.
Oh,
Yeah,
fantastic.
it's exceptional. We're very lucky that we have some talented people on our teams that allow us to do things like this that are unique. But we've learned that people will listen to different parts of that, right? And we also tie different elements to the monthly cadence that's been created. So think about Mental Health Awareness Week or Suicide Prevention Week or National Infertility Awareness Week. So
Or
we
PCOS month, or you
yeah,
cannot
there's
miss a week or a day with there is always a endo month. There's always a reason. So yes, I think that's beautiful. Please continue.
so it just allows people to know about the benefits in whatever format they like learning. It also means that someone might not really care about that preconception benefit until they start to enter that part of their life, or same with midlife or menopause, honestly, even, fertility and family planning. And so if you just keep communicating in different ways, then it allows people to hear it when they need to hear it. Uh, we have created a large number of ERGs within Progyny. For a small organization, we're only 600 people. We have quite a few, and they serve as a good place for peer-to-peer discussions on things that are impacting you, sharing personal experiences. They build trust, so when something difficult does happen, they have a core group of people that they can go to that understand what they're going through. Um, and they also talk about the benefits and what's accessed. And we have a fertility and family building ERG that has gained a lot of traction. People feel very supported within that. They can
For the
talk about,
benefit of the listeners, could you say what is an ERG?
oh, sorry, employee resource group.
I just don't want somebody to be wondering, and then not hearing your next, comment.
Oh, no,
Yes,
it's a very good point. I appreciate it.
that's
Sometimes I
okay. Our vernacular sometimes is so familiar to us, but I want to make sure everyone understands. So they get these employee resource groups that are almost like subsets of where they might find themselves or anticipate finding themselves. Because here again, someone who may not be ready to start a family now may know that there is, perhaps a menstrual cycle issue or a family history issue that warrants paying some attention before it is, as I like to say, go time, so that one can have this preconception awareness and implementation in play with all of the resources that they need. I think that's brilliant. And once again, not feeling isolated. I think that is probably the most profound thing that we can offer, especially in the workforce, because we're asking people to perform and to produce while they're suffering.
You create a community, and that's what people are really looking for. DE&I is an ongoing integrated program within Progyny, and I would say it's DEI and B, so it's that inclusion and belonging. Diversity and equity is critical, but people want to feel included and belong in a place where they work. And so if they can experience things together and see people like them, and that can be for different kinds of identities, whether it's LGBTQ plus, whether it's our BIPOC ERG, or parents, people going through menopause, people along their fertility journey. So it's
secondary
important to
infertility
encourage
is
people to find those communities within their workplace or help create them if they're not there.
And is Progyny able to then help the corporations sort of understand, where these resources are, and have their employees, sort of work within the Progyny system? Or is this a Progyny specific offer?
So it's a Progyny specific offer. I will say we talk about it externally quite frequently. So our VP of People in DE&I, Cynthia McEwen, has talked at a number of conferences about it. She has done some podcasts about it. We've had a couple of clients and even prospects talk to us about speaking at different ERGs. We have members of the Progyny team, especially our client success group, who will actually go sit and talk with different ERGs of our existing clients. And even Dr. Janet Choi, who's our chief medical officer, she's lovely.
I'm a fangirl.
I am. She's gone and talked at a number of client ERGs too. So while it's not a specific offering, it's something that we try to help facilitate whenever someone asks.
I can anticipate a beta template that can just be then applied to all of the corporations who hire you for your services, because here again, from my point of view, from my personal experience in private practice, that is the missing link. That's often what I'm providing, in addition to Chinese medicine services that support the actual endeavor. I know, because they tell me, that it is that feeling of inclusion, as you say, and belonging. I love that distinction, because it's one thing to be included, it's another thing to feel one belongs. So I love that you've added that. If I can pivot for a moment, because I want to be respectful of your time, and I could probably, chat about this one area with you for hours, but I wanted to talk about, because it's so prevalent in our milieu right now, about the trends that we're seeing in the world of family planning, family benefits, fertility, the political, the environmental, and so forth. What would you like to contribute to that? What would you like to share for the listening audience?
So I think that the political climate creates a lot of angst, right? Because people are not sure how it's going to impact them. If we're talking about, some of the state legal updates and how certain states have adopted it, others have it on the ballot for this fall, others have, whether it's abortion or how do you classify the treatment of an embryo or fetus, it's just difficult to know what is going to, be enacted. And so it makes the community in your workplace that much more important, because having someone to talk to about it, knowing that it's not just you who's concerned about it. I would imagine there are millions of people who are concerned about it.
Exactly.
We really need to talk about it and not be silent.
Yes.
And I do think that there's so many discussions now around women's health, be it preconception, pregnancy, postpartum, midlife, that there are changes happening to benefits.
Absolutely. You can hear the hoofbeats, can't you, though? I see it as a regrettable opportunity. I mean, when there's something that is that offensive, that is that present, it forces us to kind of just wake up a little bit and begin the advocacy. And just last week with National Infertility Awareness Week, and then the advocacy program with Resolve and ASRM, that had not occurred before, at least not in my awareness. And so I love that there's, there are, I was going to say boots on the ground, but I'm going to say heels on the ground in response to that. So it makes me excited for where we can go and how we can really shift the storytelling and acceptance around that.
The other evolution of product that I see in this world is a lot of companies have started out with support for different areas of your sort of women's journey in digital apps or digital content. And I think that's a great starting point, because it's a wonderful way to get people educated. But people need greater access to things like coaches and clinical support. And so at Progyny, we aim to be at the forefront of that piece of it, so that we can prioritize being innovative, whether it's family planning or wellness initiatives throughout people's diverse journey. So I'm hoping that more companies in more areas of women's health start to evolve beyond just the content and the easy access to something that goes more to what you were talking earlier on about, really the clinical support, and integrating that with the digital. The other piece that I think is continually evolving, and as we get further and further from the pandemic, my hope is that we don't see anything sort of take steps backwards, but people pulled back the curtain on their personal lives during the pandemic. Everybody saw their coworkers in a different way, whether it's like we're doing it on Zoom, kids are not running behind me right now, but they did.
Dogs in the back, dogs barking. Uh-huh.
So we're looking at each employee as a whole person and really trying to support them. Sorry, my eye. Where is critical in their life, because how you show up at work is indicative of all the other things that are going on around you. So if you give people time, whether it's to spend more time with your baby, if they're in the NICU, so we did something called NICU leave to give extra leave to someone that has a baby in NICU, or miscarriage leave, or honestly, just scheduling time. If you're going through your fertility journey and you have to go in for daily appointments and it's really difficult with work to schedule it, and that causes greater anxiety, you know, helping people feel more in control and supported in those elements of their lives will help them show up differently at work. And it's not altruistic, right? The data has shown when you provide greater support to employees, they're more engaged, loyal, and productive. And so, you know, it makes sense to help employees feel happier and healthier and give them time to navigate difficult times, because you'll see more on the back end too.
Yeah, I couldn't agree more. And that's where I get very excited because the whole corporate wellness conversation is also just blooming, as you say, not just with this conversation is, you know, fertility specific because of my little niche, but it is the spectrum of families, individual support, you know, where our focus is people with ovaries and uterus, because that's what the conversation is for the benefits, but it helps everyone, right? It's not just that person. That person is having multiple relationships with intimate partners, work relationships, you know, friends, family, loved ones, spiritual community, whatever. And in helping all of that ripple effect can only help when you come back to the nucleus of the workplace. So it makes me so happy to see this becoming more and more of a trend, not just as a way to, you know, get the best, you know, resources out of college or post grad, but also to really create this environment, because you know, the corporations of the past are past. They're not coming back. We really have to forge the new conversation in the new environment. So if you can't tell, I'm a little bit jazzed about it. And toward that end, how do you see that landscape sort of unfolding so that you know, listeners can go, wow, yeah, an insider has this point of view. Maybe it could actually come true.
You know, I've seen more progressive policies, whether it's around leave or support, coming through. Sometimes it takes a state mandate, like the fertility mandates for the states, or different leaves being enacted by states. California, you know, wonderfully takes takes action pretty quickly, and then you start to see other states follow. Unfortunately, it does take mandates to make some people see that this is important, but I think the US is starting to slowly understand that we need to support people better throughout their fertility and family building journeys. There are definitely still gaps, right? Not every state has a mandate. Not every company is required to have fertility or family building benefits. You know, in a way, that is the good part about attracting talent, because look, if you don't support your employees, there are many companies, even within your geography, that do. And people will, you know, go to those, so speak. I think, what is it? You vote with your feet.
Exactly.
So if you are not feeling supported, you're going to look to
Absolutely. And
another.
I want to just be, you know, I'm a bit of, you know, the person who does go out to march on a regular basis and so forth, an activist in all my life. And I would just venture to say, listeners, if you're not feeling supported, definitely go look. You know, there are likely other companies, other corporations that are just waiting for you and have included employee benefits packages that will support you so that you don't have to, as I say, at the beginning of the conversation, take out a second or a third mortgage to create your family. I love this idea that we've gone from being, community to nuclear, and we're going back to community again, because this whole nuclear thing that I grew up in clearly didn't work. We're seeing the ramifications of it now. It was just, it did not produce what we wanted to produce for a company, for business, or for, the country at large.
Yeah, I agree. I think
So,
there's also a very old-fashioned element of HR that is being reimagined. The training area, so to speak, is evolving to helping our managers understand how to be better managers. And that's not just upskilling people, but it's teaching them how to be empathetic, how to listen, how to create an environment that supports their employees. And that can be supporting their employees through any of the things that we're talking about today, or a multitude of other experiences that they might be going through. And so we've initiated over the course of the last 12 months, a number of different manager training programs, training them to be coaches, training them to be more empathetic, to understand how to handle situations like this, because it isn't typically part of a training program. How do you be there for an employee? How do you not just say, go talk to HR? You want to create the trust and the community within that group too, so that you can support them and they can feel like they belong to your team, just like they belong to the larger part of the organization.
So just to clarify, am I understanding that Progyny is training HR managers for whom they are say again?
No, I said I wish. No, we are
Oh,
training own employee managers.
gotcha.
We've taken on a large initiative of training at Progyny to train our employees differently. And we do have webinars where we talk about these kind of topics to clients and oftentimes to the greater audience too, around, as a manager, what could you do for your employees, or how do you show up differently? So I think that it is an important conversation to continue, because you stay at an organization not just for the benefits, but also for how your manager treats you. So if we're not training our managers to be more supportive, then we're going to miss the mark, even if you have all the most wonderful benefits in the world.
Exactly, because we're human beings and we want to be treated with respect and compassion, especially when we're going through some challenging times. And I can actually envision this. The visual in my mind is sort of that spider approach, where it goes from, these managers, and then they talk to two people, and they talk to two people. That old adage of how that game of telephone gets around. And if we stay on the same focused conversation of compassion, support, enhancing the individual human being's experience in the workplace, so that so that all of their life can be improved. How can it not improve the experience in the workplace as well? Well, I've taken up almost a half hour of your time, and so I'm grateful for it. And I want to be respectful of your time and the listening audience's time. But before we wrap up, is there anything that I didn't ask about that you want to say, oh, you know what, I really want to get this message out to the listening audience?
I think the only thing I really want to say is, like, you need a starting point. And some of the more traditional benefits in our field use things like dollar cap and more, or entry into the field, they'll use the digital apps without the clinical support. It's a good starting point, but giving your employees a benefit around fertility and family building that is equitable, that helps support them, whatever geography they're in, whatever treatment course they might need, whatever their physician and their family has decided is the right course of action, is really important, because there's a full spectrum of care in fertility and family building. And you really want to make sure that they're fully supported and they don't get halfway through something and then have to, change course, or then have to take out a second mortgage or something else. So looking at the benefits from an equitable perspective and really meeting people where they are, and making sure you're offering something that is equally beneficial to, a heterosexual couple, as a LGBTQ plus, to a single parent by choice, whether they live on a coast or in, the center of the US,
Mhm.
and there's different costs associated. It's just really important to try to get something that's equitable out to everyone,
Mhm.
and be there to support them. Don't just offer the benefit, but create the community around it that's supportive to the employees.
Mhm. And so that's beautiful. And I would say this, listeners, if you are in the HR field, listen up. There's a lot of pearl in here. And if you're not, take this conversation to your HR department. And if it feels awkward to do it singularly, maybe connect with a few of your fellow employees, create your own small group, resource group, and then take it so that you've actually got the start of a conversation that can benefit you, because at the end of the day, it really is important that you take your stand for yourself and be the best experience and expression of yourself as you can be. So
I completely agree. And we
thank
have
you.
resources on our site that say how to talk to HR. So
Ah, perfect.
Resolve is also a great resource. They're the nonprofit organization that supports the infertility awareness. They have a lot of great resources. So there are places to go so you're not starting blind or feel like you're alone.
And I'll put all of these in the show notes so that you just, click through and begin your own heels on the ground. If this is stimulating you to kind of take matters, take your life back. So Cass, thank you so very much. Again, I know that we could go on for hours, but maybe we'll pick it up at another time and go down another thread that is perhaps not fertility, but maybe more, okay, postpartum or as you say, the perimenopause time frame. So I'm sure we can carry a conversation on ad infinitum. But at this point, I'm going to let you go back to your business at hand and say to the listening audience, as we say at the end of every show, class dismissed at Health University.